So welcome to our second programme of Caseworker webinars. So these are webinars that National Training Committee have asked us to sort out for our caseworkers. They all will take place on a Friday. They all take place between 1 and 2 o'clock because that is the time that we found most people have facility time, Friday afternoon, and are most likely to attend. This one is the first of 4 autumn webinars, the others being negotiating behaviour management policies and the risk assessment of pupils, the rise of the far right, and addressing LGBTI discrimination in the workplace. Now, this topic, prostate cancer, came about actually from our menopause courses. What we found was quite a few members raised issues about men having treatment for prostate cancer, experiencing similar symptoms to women going through the menopause. And when we talked about risk assessing, it became apparent that actually men would also benefit from the same equality, health and safety risk assessment information that we provide to our menopausal women. So that's why this particular webinar has been decided upon. The webinar is being recorded and it will be made available after the session to caseworkers who were unable to attend today. And attending this webinar will count towards your ongoing accreditation. Now, with no further ado, I'll introduce Jeff Smith. The webinar was due to be delivered by Mark Dickinson, Chair of Training Committee, but unfortunately, due to IT issues, he's unable to deliver the webinar today. So we've asked Jeff Smith, who's a Senior Health and Safety Tutor and Officer, to step in at the last minute. So thank you ever so much to Jeff, and over to you.
Good afternoon, colleagues. Yes, my name is Jeff Smith, and I am the Secretary for NASUWT in Cheshire East. I am a health and safety rep in my school, and I'm also the chair of the Northwest Regional Health and Safety Committee. So it's an absolute pleasure to be here today, launching the Prostate UK supporting webinar, and hopefully we can get this disseminated across all our membership. So the first slide is supporting prostate cancer UK, please, Kim. One of the things I just want to say is men's health can be a minefield. There are many myths that circulate in the pub, at work, online, and with family and friends, and sometimes it makes it hard to understand and get the correct information. So today what I'm trying to do is to give you that information, give our members that information, and support our members through this very difficult time. So our research shows that most common cancer in men starts in a place half of us know next to nothing about. So it's also about education. So it's time to change that, time to change people's perceptions, and let our members understand why it's important to ask for support early on. So one of the things I think is really important in this webinar is that I have no medical training. So all the information that's been obtained comes from the NHS website, Macmillan, and Prostate Cancer UK. Prostate Cancer UK has given us permission to use their logo and their information sharing for the webinar today. So we'd really like to thank Prostate Cancer UK. And one of the things I would say is that Prostate Cancer UK, particularly their website, is absolutely fantastic on this subject, and they have so many wonderful resources. Okay, could I go to the next slide, please? Prostate cancer. So one of the things I want to say is like prostate cancer is considered a male condition. Okay, that's the first point. But so much of the information discussed today is due to research carried out with men. But however, prostate cancer may also affect trans women, non-binary people who are assigned male at birth, and some intersex people. So for these three groups, the experience may be slightly different, but they should seek help and support from their GP. and visit the Prostate Cancer UK. So that's the key issues. So just a little bit more detail on that. A trans woman is someone who was assigned male at birth but identifies as a woman, and trans women can develop prostate problems even if they've taken hormones. The prostate is not removed during genital reconstruction, so it's still there and could cause a problem for that individual. A non-binary person may not identify as a man or a woman, and an intersex person may have both male and female sexual characteristics, and so might have a prostate. So again, any issues on that, and support, Prostate UK is the place to go for trans women. Amazing resources, but we do take that into consideration, and that is really important in terms of support. So next slide, please. Prostate cancer questions. According to Prostate Cancer UK, almost half, 44% of men do not know where their prostate is, and 74% aren't sure what it does. So in terms of the questions we need to ask is, what is a prostate? Where is the prostate? What does it do? Who is at risk, and how many dads, sons, brothers, and mates die each year from prostate cancer? So only like sort of 35% of men are aware that early stage prostate cancer often has no symptoms at all. So that's significant. So any tiny changes are really important that people seek advice and are aware of it, because ultimately it can save your life or a loved one's life. Next slide, please. The prostate. So the key thing about the prostate is a small gland in the pelvis that is part of the male reproductive system. So you can see an image of it there. So about the size of a walnut, it's located between the penis and the bladder and surrounds the urethra. Now, also, particularly when men have prostate cancer, you can see where it is and the issue that you might have with the urethra going through the prostate, because that can cause issues in terms of incontinence when the prostate is removed and the urethra has to be joined together. So that is a problem that we will talk about later on. So the prostate's main job is to help make semen. So could I go to the next slide, please? So assessing the risk. All right. Your chance of getting prostate cancer may be even greater if your father or brother was under 60 when diagnosed. So it's really important to know your history, and to talk to your family and to get that information. So, if you do have that, again, have that conversation with your GP and make sure that they're aware of it, okay? So, 50, you're age 50 or over, it mainly affects men over 50, and your risk increases as you get older. But one of the things I would say, if your family has a history of it, or you get any of those symptoms before you're 50, then seek advice. Go to your GP and have those conversations, because it might be that you have a very quick PSA test that just checks your PSA levels. Your PSA tells the practitioner if your PSA rises, there might be an issue. So that's why the PSA levels are checked for potentially issues around prostate cancer. So the other, as I said before, your father or brother has had it. You are 2.5 times more likely to get it if your father or brother has had it. So communicate that with your GP. So the other thing as well, which is really important, so if you are black, 1 in 4 black men will get prostate cancer in their time. So that's really important that, again, you have that information and potentially some form of screening. Being obese may increase your risk of having a more aggressive form of prostate cancer. So again, the health side is really important. Next slide, please, Kim. So in terms of information for black men, 1 in 4 black men in the UK will get prostate cancer. 1 in 4 at some point in their lives. This compares to 1 in 8 white men. So it is significant that our members are aware of that. It is less common in Asian men, and the reasons are not clear in terms of the research that's been carried out, but it could be down to genetics. So Prostate Cancer UK advises all black men over the age of 45, not 50, 45, to talk to their GP about their PSA test. Okay, so the thing I'd like to clarify, that men who self-identified as Black African, Black Caribbean, and Black other Prostate Cancer UK research. So they're the group that needs to have those conversations with their GP around earlier age of 45. And that's really important that we get that message across, whether we're doing it in schools or we're talking to people, local association meetings. So what's really important, could I have the next slide, please, Kim? Changes to look out for. So the real changes that is important for you or your family, or, to be aware of your loved one, because is the need to urinate more often than usual, especially at night. So if you need to go and use the bathroom and it starts to, you start to get that increases, go and see your GP, get a PSA test. Difficulty starting to urinate, get a PSA. Straining or taking a long time to finish urinating. I mean, sometimes, again, could be an inflamed prostate, but it's just good to have that clarity. A weak flow when you urinate, a feeling that your bladder hasn't emptied properly, a sudden need to urinate, sometimes leaking urination or urinating before you get to the toilet, and just dribbling urine after you finish urinating. So these are the signs. Or even if it's painful when you urinate as well, any blood or anything like that in your urine, just seek advice from your GP. Okay, thank you. Next slide, please, Kim. So side effects of treatment. I think this is really important that we look at this in terms of, we're going to move now into equality and health and safety risk assessment. So side effects of treatment. Different treatments for prostate cancer present different side effects, but below is a list of the most common. So for example, if you have surgery, it might be that the incontinence might be one of the things, whereas if you have radiotherapy and hormone therapy, continence might be one of the issues, but it might be you're exhausted, you're tired, you have brain fog, etc. So in terms of the treatment, there are side effects for different treatments that you have. But again, on the if you're helping individual members, you can look at that information and support through through Prostate UK, Macmillan, etc. So just a few. Urgency to use the toilet. Hot flushes is a really important one to be aware of, and that was picked up, I think, within what Kim said in the menopause training. Extreme tiredness, strength and muscle loss is really important, because the importance of exercise for individuals. Bone thinning. Weight gain is significant, particularly if you're on hormone replacement. You can go up between 1 and 1.5 stone in weight if you're on the medication. Strokes because of the chemicals particularly for hormone, and type 2 diabetes. So some members need time to process as well and accept their diagnosis. The mental stress is significant, but there is also support there through Macmillan and Prostate UK that you can get. But the other thing I would say is this: it's not just the individual who goes through that. It's the family, it's the children, it's the loved ones. They have to go through it as well. And the charities such as Macmillan have incredible support for the families that you can support that individual with. Okay, may I go to the next slide, please? So, prostate and equality law. All right. The Equality Act 2010 in England, Scotland and Wales, and the Disability and Discrimination Act in 1995 in Northern Ireland. So it provides workplace protections for members diagnosed with cancer. Okay, but the members, when they do get the cancer, is to encourage them to inform their employer, because the employer can't make any reasonable adjustments unless they're told. This is what we said about pregnancy risk assessments, etc. So this is because the employers have a range of legal duties under the law to support and protect the employees. Okay, the other thing as well is that it's important. The legal protection against discrimination does not end when your cancer treatment finishes. If you have been diagnosed with cancer in the past, you will continue to have legal protection against discrimination, even when you no longer have cancer. So, also known as remission, and you will also have a protection if you move to another employer. So it's really important, if you do move to another employer, that they are told about the condition. Okay, next slide, please. So equality law, employers' responsibilities. I'm going to pay a little bit more attention to number 5 and 6 here, but all these strands of prohibited conduct are applicable to members diagnosed with cancer. So direct discrimination, indirect discrimination, harassment, victimization, failure to make reasonable adjustments, discrimination arising from disability, and discrimination based on association or perception. Okay, so the importance, 5 and 6, these are the of particular importance when returning to work or remaining at work. And in Northern Ireland, it's similar with the DDA in 1995. Okay, can we go to the next slide, please? So, failure to make reasonable adjustments. Duty to make reasonable adjustments require employers to take positive action to remove certain disadvantages to disabled people posed by working practices and the physical features of the premises. So consider the side effects of treatment. There are a number of simple, reasonable adjustments we could ask of the employer. The important point here is to, particularly when you're representing members, is to know and prepare for that meeting in terms of the reasonable adjustment. There's many employers out there who are fantastic and they know, how to work this through HR, etc. But there are many employers who don't. So what I'm saying to you is sometimes they need to be guided and to understand the legislation. And that is problematic, I understand. Sometimes we have to make the decision. If the manager can't manage, then we have to manage the manager. So other important points to note, the employer's duty under the provision is to take such steps as reasonable to have to take to avoid the disadvantage that would otherwise be suffered by the disabled person. I mean, the employer must have knowledge of the disability, and basically they need to understand the reasonable adjustments that will allow that individual to engage as normally as possible in the working environment. Okay, may I go to the next slide, please? So, discrimination arising from a disability. It's unlawful for an employer to treat a disabled person unfavorably because of something arising from his or her disability. So under the Equalities Act 2010, equality law, you have the right not to be treated less favorably than other workers. So because you've got prostate cancer, you shouldn't be treated any differently. But the other thing I think is really important as well is agency supply teachers. Okay, they need to be treated as exactly the same. So they also have important additional rights to equal treatment under the Agency Workers Regulations 2010. So some of the rights apply from the first day of an assignment, while others require you to have worked in the same job for the same hirer for 12 weeks. But be aware of that when we have supply teachers. And also it's important that those supply teachers are supported. They should be treated, again, what I'm saying is they should be treated no differently from anybody else. Okay, next slide, please. So using the legislation, the Health and Safety Law, the Health and Safety at Work Act 1974 and the Health and Safety at Work Act Northern Ireland Order 1978. This is important. It requires employers to ensure that health, safety and welfare of their workers and take measures to control any risk that is identified. Usually the health and safety is the one that they look at, but employers have a tendency to forget the welfare aspect, and that's important. So also employers are required to carry out risk assessments under the Management of Health and Safety at Work Regulations 99. And for Northern Ireland, it's the Management of Health and Safety at Work Northern Ireland 2000 and Section 75 of the Northern Ireland Act 1998. This should include any specific risk to a member with cancer. So using the legislation, making reasonable adjustments, carrying out a risk assessment, welfare issues in terms of stress. The law requires employers to assess the risk of stress-related ill health arising from work activity. Now, what I'd say to you is when a member is diagnosed with prostate cancer and they go off for their treatment and they come back to work, usually they go to their occupational health meeting. I would suggest having that conversation with the member before they go to that meeting. So you can, I'm talking to secretaries now, just to give them, the advice and look at the information that the NAS has just, given. And also when they come back, is to look at the stress risk assessment as well, because the mental stress of going through the cancer is an integral part as well of the ongoing conversations that we need to have in terms of reasonable adjustments. And the other thing I would say is this: cancer treatment is ongoing. So particularly if you're taking, hormone suppressive injections, for example, that could be problematic. So the risk assessment, the whole process is live, and it should be looked at continually on a regular basis with a manager, with the workplace rep, and with someone who is competent on risk assessment. And that's really important. Okay, may I go to the next slide, please? So, for example, if we look at how we look at risk assessment, so on the left-hand side, you've got the side effect, urgency to use the toilet, leaking urine. So examples of workplaces, factors which could worsen or interact with the symptoms. So lack of access to adequate toilet facilities may increase the risk of infection and cause distress and mental stress. That would be looking at the work regulations 74 and then the stress regulations 1996. Also the embarrassment and the increased stress of it. So staff members may need to access toilet facilities more frequently. So suggested adjustments: ensure easy access to toilets and washroom facilities, allow more frequent breaks in order to go to the toilet, look at the members' timetable to see how it works, give them that flexibility. It might be that they require a walkie-talkie to talk to someone to come in and just look after the children when they need to access the toilet. This is how you work through a reasonable adjustments. Extreme tiredness. So particularly if someone's been on radiotherapy or hormone injections, suppressors, then tiredness can play a major part. So flexible working options. Consider temporary adjustments of hours to accommodate any difficulties. Reassure workers that they will not be penalised or suffer discrimination because of what they're going through. This is really important in terms of the culture within your organisation. And this is also something that we'd be looking for in terms of our valued workers scheme. So psychological symptoms, memory problems, difficulty concentrating. Certain tasks may become more difficult to carry out because of the mental changes, brain fog, for example, fatigue and lack of remembering. So, for example, if someone has a management responsibility, that might have to be looked at and adjusted so that person is able to cope and feel supported. So, to carry out a stress risk assessment and address work-related stress through implementation of the HSE's management standards. I would go to the management standards because it's a fantastic tool. And it's a really interesting document and really helpful when you're considering stress in the workplace. And if you look at those elements, relationships, workload, etc., again, it could be that you look at considering flexible working, offer and facilitate alternative methods, offer more admin support, etc. So it might be that there's a change to how parents' evenings done. So, it's maybe done online or it's actually cancelled, and a different way of communicating is found. Okay, can we go to the next one, please? So, prostate cancer, a workplace issue. It is important that the trade unions raise the issue in the workplace. I mean, we as a trade union, I'm very proud of the fact, really drove the menopause, and I think it was down significantly down to us that we had policies implemented. But prostate cancer is significant, and it should be particularly on on the agenda in schools, to actually drive the information from Prostate UK into schools, to get organised and consult with members to find out what they need in school and college. It might be that they have training events within the CPD, or when they have twilight sessions, that is part of the training event. And it's not just, as I say, when we did the menopause, it wasn't just a certain gender, it was everybody needed to know about it and everyone needed to be trained on it. So set up a health and safety committee. Remember, if two different unions request in writing to the employer that they want a health and safety committee, it should be set up in law within 3 months. And they would put the constitution together, and then the committee could be driven, particularly again in academy trusts. That's something that secretaries would look to do. So if you're a rep or a member in there, it's about getting organised. It's about talking to your secretary. It's about talking to your health and safety officer and seeing what we can do for you. Consider it a workplace campaign, support group. There's amazing stuff out there. Prostate UK is amazing. You could do meeting rooms, coffee mornings. There's loads of events that we can push it. And it's an absolute, really important that we do this, because if caught early, prostate cancer, it's pretty much resolved and sorted. It's if we leave it too long. So check workplace policies, discuss this with your employer, and see if we can improve those policies in any way, shape or form. Okay, next slide, please, Kim. So what can workplaces do? For me, as like the menopause training, managers and staff need to be trained on prostate cancer. They need to know how to manage. They need to know how to support. Clear policies developed in consultation with unions. Awareness raising is really important. Ensure risk assessments, occupational health referrals are done correctly and supportive, making sure the manager understands how to carry out the risk assessments is important as well. Establish recognized points of contact within the workplace. Improve access to support within the workplace, giving information about, say, Macmillan or prostate cancer. Provide decent teaching management jobs. That's really important. So those individuals have the right to develop their careers and continue to develop, particularly even if they want to move. Why should they be seen as any different because they're going through this difficult time in their life? Okay, next slide, please. So in terms of additional support, the NASUWT has got equality and health and safety updates. Prostate cancer is just amazing. They've got specialist nurses. You can also email or chat to them online. They've got like a support group on there, which is fantastic. NHS is an amazing tool to go to. Macmillan Cancer Support is also good. And what I would say to you, if you do come, unfortunately, get in that situation, my advice to you is go to those websites. Go to a prostate, NHS, Macmillan. There's tons of stuff on the website about prostate cancer. But if you go to those websites, the information you're getting is correct. Okay, so in conclusion, prostate cancer, critical part of our development as NASUWT. Our job, our action points are to get people to be aware of it, supported, and to drive the agenda for all concerned. So on that basis, I'd just like to say a massive thank you to you all. I'm going to just hand back to Kim, and thank you for your time.
Thanks, Jeff. I'm just checking. Is there any questions for Jeff while you're on the webinar? I mean, one thing that we did discuss actually before we went live is the action short of strike action instructions as well that the NASUWT have issued to some workplaces. Again, you can use those to help our members and just remind them of the action short of strike action instructions. If they are saying, well, I'm a teacher, this can't work in my workplace, we do have information there to support our members should they need it. I did see somebody. David, thank you ever so much for your comment. If you have a family history and you're 45, get a PSA test. I was 48 and had prostate cancer with no symptoms and I'm white. And again, I think, yes, that is important. If there's any concern at all, we would advise you to visit your GP. And when we say a PSA test, and again, I appreciate I'm a woman, it is a blood test. Jeff might be able to help you more on what it actually tests for. I think it's proteins, but it's just a blood test. That's as simple as it is, and it doesn't always mean that you have prostate cancer. It just means that there might be a concern with your prostate, and you just go and see your GP. Is there anything else you want to add to that, Jeff?
No, Kim, I think you've made a very good point. The key thing is if you see any difference, whether you're over 50 or under 50, then seek advice. Just go to your GP, tell them that your issues with say WIN or etc. Ask for a PSA. It's as simple as that. Just ask for a PSA. 90% of the time the PSA will come back and it's nothing to worry about. But if there is, then the earlier we get it, the earlier we can get it treated.
Thanks, Ava. Hang on, let me just read what Ava said, really.
Yeah, I can talk about that, Kim.
Yeah.
Metastatic, right. Yeah. If you've got a situation where the cancer has if you go into stage 4, etc., and it becomes metastatic, then of course you're in a different situation, and the way that the cancer is treated could be significantly different, and therefore we need to make those reasonable adjustments. And you say, usually the bone is the place that it goes to, and again that would come in terms of the reasonable adjustments for supporting that member through that. As I said to you earlier about reasonable adjustments, how they're looked after. So yeah, it's all the way through, whether it's a stage 2, stage 3, stage 4. The process I've talked to today is really important, but I do take into consideration when it gets to that point, mentally as well, it's significant, and we need to make those reasonable adjustments. So thank you for making that point.
Okay.
Luke,
when writing risk assessments, should we as reps be directly involved in the process or just be checking them?
Yes, I think for me, if I'm supporting a member with prostate cancer, and what I said to you is making sure that the person who's doing the risk assessment is competent, because I've got that experience that I can go and help. My job is so I would say yes, because it's about working together. I'm part of that management team to support that member back into work. And it might be that the employer has missed something. So I would always say that the risk assessment is an important discussion. Particularly, I think, as a secretary, supporting that member back into work. If you're a rep, it might be slightly different. I'm talking about a secretary here, supporting a member back into work. So I would always be part of that journey and conversation.
And also, I would say to that it isn't a document that then is shelved and forgotten about.
No.
As Jeff made a point earlier, it is a live document. We should always be returning to that. And if reasonable adjustments haven't been put in place that have been agreed, again, it might fall into the whole discrimination category, and then we should be seeking help from regional or national centre. We know, don't we, with any potential discrimination claim, we should always seek advice at the earliest possible time from our regional or national centre.
You have, I would say, when you're going back into work, it's about, having those maybe weekly conversations with your employer, particularly if you've had prostate cancer and you're coming back in. You need to have those conversations continually, because the situation can change very, very quickly. It's about being supportive, both parties working together to find the way forward. We need a campaign, it says here, Kim, on sanitary bins for male colleagues in all workplaces. Boys need bins. I think that's a really good point, and that's something that Ava, I will put on my my next agenda. So that's fantastic. Thank you.
There's just one from Nigel. Can you suggest, please, some examples about what we could cover in a health and safety meeting with employers, i.e., where would we start?
Well, what I said again is the importance is setting up the committee first. And that's why I said about 2 reps requesting it. Then it's down to the employer to set the constitution and making sure that constitution is right. Then we can start to use things such as, doing a collective inspection, like a baseline, to have a look at what the problems are around the site. We could look at things like behaviour, for example, looking at your reporting systems in terms of behaviour and seeing what the behaviour is like. Are there any trends to the behaviour? Looking at children risk assessments, because we know behaviour is a significant issue. Doing a stress risk assessment across the school. The NASUWT has a central risk assessment tool, and we can look at that collectively, and we can start to work on it, to look at what we're doing well, but to look at areas that we can improve on. And that's why the HSC is a really good site for managing stress. So it's about getting the right people in position, and that's why I would say within your association is to try and get more health and safety reps in schools and get them trained, because the union, myself, we train reps up to a very high level that can help the employer. It's not a battle between two. Health and safety should not be a sticking point. It should be everyone working together to improve the health, safety, and welfare of everybody. Have a look at the wellbeing charter, the NASUWT Valued Workers Scheme. Great opportunity for employers to get engaged in. So there's a lot out there on health and safety at the moment, particularly on retention. So it's a big thing. But remember, like, doing yoga is fine, but really, is that just a sticking plaster for bigger issues? So that's why the NASUWT's health and safety provision is so good.
And also, I would just say there, Nigel, because if you were just thinking about prostate cancer, we can share some of this information with our tutors out there who might want to run this as, say, reps training, something like that. Or you could just ask your management to consider staff training, whole staff training. This has been 35, 40 minutes, but the reason why Prostate Cancer UK allowed us to use their logo was because when I contacted them, I said, we're not making a profit. We're not doing it for any other reason than to raise awareness, because that's what they want us to do. And we could do that in schools.
Remember also, there's another good one from Ava about employers need to recognise the effect of prostate cancer on performance. Absolutely, Ava, particularly if the individual has been off for treatment, or they've had surgery. Those reasonable adjustments have to be made in terms of the performance management and the targets. So, maybe there's no targets that year, or there's one target that has already been achieved. So that's why that's really important as part of the conversation in terms of reasonable adjustment and stress. And I think there was another one from Christopher as well. Do you want me to answer that one, Kim?
Yeah.
Okay, so it says, hi, all men must not be too proud to go to their GP. Christopher, you're absolutely right on that. That's the first point you make. All men should go to their GP if they've got any of the issues straight away. And if you've got a loved one, if you've seen this now, if you pick it up, just make the appointment for them, get them seen. But not all prostate enlargements are cancerous. That's a very good point. It's like prostatitis. I think it's an inflammation of the prostate. Yeah, again, the PSA might rise because of that. They would do, they would have a look at that, maybe do an MRI or a biopsy, and it comes back completely clear. But at least you're getting the information and you're making sure that everything is okay. It's not difficult. It's not difficult to book a PSA with your GP and get checked out.
And we've got two more points. We've got Ian, who said, do we have any info advice, read the recent news stories, re-MRI scans, pick up some cancers that PSA doesn't, but there's no national screening program at the moment.
Yeah, there's no national screening program. Yeah, and it's a very good point about the MRI scans, and I think that's in development. I think the process of prostate is usually PSA test, then it would be a biopsy, then MRI or PET scans to look at the information. I think what they're saying is the MRI is a quicker way of doing it, and it gives a very precise overview. So I think with the National Health Service, you still get a very detailed process in terms of prostate cancer, knowing if you've got prostate cancer or not. But maybe that process will change slightly as this MRI process comes through. I think in America that they do have screening, and I think that a lot of people are pushing to get screening for men over 50. But as I said, that's why we're trying to do this, and this is why Kim's developed this today, this webinar, is to get people to be aware of any changes, so you can get in early and get that prostate, that PSA test. You might not get any symptoms, but as I said, historically, look at the contextualization of your family. You might not be having symptoms, but again, have that conversation with your GP and have a PSA.
Thanks, Jeff. And then the last comment, and again, this is a very relevant, valid point that Ava makes, the effect of prostate cancer on families.
Yeah.
So, as a teacher, you could be expected, we were in very stressful jobs, aren't we? We're in every day, we're giving the best of ourselves. And you could be the teacher of a partner with prostate cancer, supporting them, but could also affect performance at work. And I think, that is a very valid point, because Jeff mentioned earlier, it isn't just the person that goes through the process. The whole family goes through the process with them. Same as if it's a woman with breast cancer, it affects the whole family. So that's a very valid point.
I think that's a really important point to make. But I would also say that Macmillan, I know that Macmillan has support for that you can access to support people, family members going through it. The other thing, Ava, the other thing is children, if they're going through exams, etc., to have those conversations with the schools and to offer and give them support as well. So I do not see this in isolation. And you make a very good point that, those adjustments, those stress adjustments for individuals who are supporting people through that, it should be triggered. And again, risk assessment should be carried out. So yeah, that's an excellent point, Ava, and thank you for that.
Right. Well, it seems like we've come to the end. There's no more questions in the chat. So on behalf of NASUWT, thank you ever so much, Jeff, for stepping in at the last minute and delivering the webinar. And thank you to all of you who have attended this webinar this afternoon. Have a wonderful rest of the day and a great weekend, and we'll see you again soon.